Hi guys, this is Shamima, Dr. Sattar. I'm an internal medicine doctor, board certified and practicing in Texas. I see internal medicine patient. I also do medical clearance for about 20 psychiatric hospitals in Texas. So I see a lot of patients with depression. Yes, you guessed it. Today's topic is depression. How common do you think is depression? About 5 people out of 100 self-report depression. 8% goes to a doctor's office seeking help. About 22% of ER visits are due to depression. From 1999 to 2019, there has been 48,300 plus deaths due to depression. Yes, it is that common. Which country in the world has the most depression? Can you guess? It's India. Next is China. Do you think that's surprising? I do. All right, I wonder why. Can you tell me if higher IQ people have more depression? Yes, they do. Can genetics transfer depression? Make their children more prone to depression? Yes. Can alcohol, substance abuse cause more depression? Yes. All these things we have to remember when we are thinking about depression. Today, the reason for discussion is for you to be aware of depression amongst us. It can be our children, it can be our friend, our family, even patient as providers. So yes, we have to be very vigilant about depression. What are the common symptoms for depression? Can you tell me? Little or no interest or pleasure in doing things, feeling down, depressed, hopeless, trouble falling asleep or staying asleep, or not sleeping at all, feeling tired, feeling very fatigued all the time, feeling bad about yourself, always thinking that you're just worthless or a failure, trouble concentrating in things such as reading, working, moving or speaking very slowly, thoughts about death, or self-harm in some kind of way, especially in teenage girls. They would be cutting themselves, they would be scratching themselves. These are self-harm symptoms. We have to be very vigilant. Mom and dad, watch for these signs for self-harm because they try to hide it by wearing long sleeve clothes. And you might be surprised. Some of the patients, the parents have no clue. And in this day of social media, sometimes these patients, young teenage girls, are in school and searching on website about means to hurt themselves. And the school authority gets notification and alert. They call police, send the patient to the psychiatric hospital, and mom and dad gets the call. Yes, that is horrible. That's not a call you want to get. All right. And in many heritage, in many races, people do not believe in depression. They don't think their kids can have depression. It's a stigma. So before they can admit to this weakness, they would rather say, no, we don't have this problem. We don't have to address this. So yes, please throw these thoughts out. Think about this. Depression is a medical illness, just like diabetes, just like heart disease. Diabetes comes from the pancreas, heart disease occurs from the heart, and depression occurs from the brain. If you do a CT scan or MRI of the brain, you will see the amygdala is big. It's a part of the brain that is big. So there's signs, symptoms, and presentations for depression along with that findings. So yes, we have to think about it. And we have new medication, new therapy happening all the time. So do not lose hope. This is something that is curable. This is something we can take care of. So what are the types of depression? Major depression, the one that is severe depression. People are feeling so low they cannot get out of bed, or they cannot sleep, or they keep on having interrupted sleep, fatigue, they don't want to eat, or they overeat, and they think about death all the time. The more frequent, the more dangerous. We have to be vigilant about these patients. Ask them, do you think about the people you have to stay alive for? Your kids, your friends, your family. And some of them will say, yes, that's why I'm not doing it. There might be some patients who will say, no, they are going to be better off without me. Those are the patients you have to think about. Yes, you will be surprised who does what. So be vigilant as a friend, family, and provider. The next type of depression I want to talk about is bipolar. This is very interesting. This kind of patients come to the ER. Sometimes they're picked up by the police, and the patient will come and say, doc, let me go. I have important things to do. You don't understand. I'm President Trump's closest advisor. I'm here to save you from COVID-19, and you are holding me here. You are wasting my time. Just let me go. I've had another patient who came in and said that, doc, I am here for just to check out this thing, and I don't really have to be here, but I want to let you know I'm a doctor and I'm specialist in 5 different departments. So understand, I'm very important. I am very busy in this kind of scientific studies. You need to let me go so I can work on it. I have to save this world. This kind of patients are very hyper-religious. They have strong faith for God, and they think they can hear their voices, hear Him tell them to do things such as hurting themselves or even others. We have to be very careful about them. Third, I want to talk about cyclothymic depression. This is a low-level depression. People like these, especially if they're very high IQ, they can even hide their depressive symptoms. They usually are able to function their low capacity way in and finish their work. They come home, they might sit slumped down in their chair and just go through the motion of the day. They usually finish all their work, and most of the time they're just depressed. And this can turn and keep on going on and on for 2 years. Next, I want to talk to you about postpartum depression around pregnancy, during and after. These patients may have depression long-term even after they give birth to the baby. Yes, depression is common. Very, very common. I actually lost a brilliant cardiologist due to depression. I talked to him and I offered him help. He kind of said, I'm okay. Don't worry about me. I left. A few days later, I found out he killed himself. It is hard to lose family. He's like a family, right? He's my colleague. We don't want to lose anyone to depression or anyone else. Mom and Dad, I want you to be especially vigilant for teenage girls. Social media has made our lives so much more difficult, better, both at the same time. What happens now, we have social media that tells us every way we can hurt ourselves. All these girls and young boys can go
keeps a doctor
at
away.
school.
Until next time, see you. Take care.